Good morning, everybody. Thank you so much for joining us today and attending our webinar, How to Respond to COVID-19 in the Workplace, hosted by the City of Mississauga's Economic Development Office, with a presentation by Dr. Alia Sunderji from the Region of Peel Public Health. In today's webinar, Dr. Sunderji is going to discuss how to control the risk of COVID-19 transmission through screening and contact tracing, what steps to take when you suspect a COVID-19 case in the workplace, and the different roles and responsibilities of organizations, including public health, employers, and the Ministry of Labor. I'd like to introduce our panel today. My name is Jackie O'Connor. I work for the City of Mississauga's Economic Development Office. My colleague Walter Garrison has joined us to share some updates on what our Economic Development Office and the City of Mississauga are doing to support the business community throughout this COVID-19 crisis. Amanpreet Bains has joined us to provide some technical support. And of course, we have our special guest and presenter, Dr. Alia Sunderji. Before we get started, I'd like to cover a few housekeeping items. Whether you have a technical question or you would like to submit a question for the Q&A at the end of the presentation, please use the chat function located on the right-hand side of your WebEx screen. And I recommend that you select all panelists, and this way it will ensure that your question doesn't go missed. I'd like to let you know that we will be distributing a copy of the slides presented today, as well as some other resources provided by the Region of Peel Public Health in an email following the presentation and webinar. In this email, you're also going to find a follow-up survey so you can provide your feedback. We'd greatly appreciate you taking the time to complete the survey, as your insights will help us continue to deliver content that's valuable, as well as different services that we may involve. One last thing to note before we move to the agenda is that today's webinar is being recorded and it will be shared with you at a future date. So now, just to set a brief agenda for today's webinar, we will begin with a short presentation by Walter Garrison. As I mentioned, we'll provide you with a few updates on our economic development response and the City of Mississauga's response to COVID-19. We're then going to have a very informative and rich presentation by Dr. Sunderji, and we will have some time at the end dedicated to a question and answer period. So I'd now like to pass it off to my colleague, Walter.
Great, thank you very much, Jackie. Our Mississauga Economic Development Office is continuing to provide support to our Mississauga business community. And this webinar is a direct outcome from the feedback that we have received from our Mississauga business community in our outreach and in our roundtable meetings. Our EDO COVID-19 recovery webpage is continually updated with new information so that our businesses have access to the most current supports. And we will continue to hold roundtable meetings with our business community to learn about how COVID-19 has specifically affected their businesses, your businesses, mitigation actions that they have put in place to prevent the transmission and spread of the virus, and learn how we can support our businesses and share best practices. We will continue to provide opportunities for our companies to network, learn from, and assist each other. And a B2B platform for our companies to share information in real time will be one way for this to occur. Our EDO is working with other City of Mississauga departments in developing a COVID-19 economic recovery plan, and we look forward to continuing to engage with our Mississauga business community. Through our Economic Development Office and continued outreach and engagement with our Mississauga business community, we have learned how COVID-19 is impacting our businesses on the ground. Our diverse businesses in Mississauga have experienced many different challenges as a result of the pandemic. And some of the most common impacts of COVID-19 have included supply chain risk and disruption, financial cash flow issues. Companies are employing robust business continuity practices and mitigation strategies such as physical distancing in their operations. Access to personal protective equipment has been an issue for many businesses, whether it be N95 masks, surgical masks, gowns, gloves, or face shields. And the pandemic has also accelerated our companies undertaking operational and process changes that they were either planning to make or had to make in response to the pandemic. And I'd just like to talk a little bit about our COVID-19 recovery page. So if you go to the Future is Unlimited, On the top, there's a yellow band. And if you click on that COVID-19 response, we have our COVID-19 recovery page. And now that we're in stage 2, we have different sections in our recovery page, including economic recovery initiatives, specific guidelines for health and safety and reopening, sector-specific guidelines, personal protective equipment access, the business relief portal, which many of our businesses have commented have been very useful aggregation of municipal, provincial, and federal government relief programs, and a countermeasures portal as well. We also have online webinars to support businesses, and we would like you to share your feedback on this page as well. In addition, on our webpage, we have a link to Mississauga Made, which is an online initiative to support and promote local businesses across the city. And during these difficult times, we encourage our residents to stand together and support locally based businesses, services, and talents in our community. And if you go onto our webpage at the Futures Unlimited Mississauga Made, you'll see a link to that. And we highlight a number of local businesses in a number of categories, including Eats at Home, music and art, virtual attractions, Ontario chapters, and Experience Mississauga, which includes free Wi-Fi locations, park maps. And our shops online offers retailers in our city another opportunity to market their products. For many of our businesses, the COVID-19 crisis has highlighted the importance of having an online presence to sell goods and services. In order to address this need, Digital Main Street has collaborated with Google, Shopify, Mastercard, and Microsoft to build and optimize online stores for small independent businesses and artists in just a matter of days. And so our businesses get their choice of an online store customized with their information, branding, and logo, hands-on assistance in setting up and launching their online store, training to support their online store, including training in digital marketing, shipping, and inventory management, and access to free tools to help support the launch of their online stores. The Digital Transformation Grant provides $2,500 to each qualifying small Main Street Ontario business to purchase and adopt digital tools and technologies. Now, you will have heard, many of you, that yesterday our council passed a mandatory face covering bylaw. And so we do have on our Mississauga website a link to the face covering bylaw, the specifics of the bylaw. We have frequently, and we have questions and answers for it, so FAQs, specific locations where you would have to wear a face covering, what businesses need to know, and exemptions for people and businesses on this, and the enforcement as well. So we've got this all on our City of Mississauga webpage. The one thing that I would like to make note of is this Monday at 9 a.m. we'll be having an online webinar on the mandatory face covering bylaw, and our Director of Bylaw Enforcement will speak to the specifics of this. And we also will have a representative from the Region of Peel speaking about masks in general. I would recommend that you sign up for that, and we will be distributing a link to that in the chat function later on in the presentation. So now I would like to introduce Dr. Alia Sunderji from the Region of Peel. She's a public health physician, and she works in the ER at the Hospital for Sick Children as a pediatric emergency physician. She also has obtained a Master's of Public Health degree from the Johns Hopkins Bloomberg School of Public Health. And Dr. Sunderji is assisting in developing a proactive workplace strategy for the Region of Peel. So I'd now like to turn it over to Dr. Sunderji. Go ahead, Alia.
Thanks. For that very kind introduction. I first wanted to commend the Economic Development Office of Mississauga for their proactive work in reaching out to Peel Public Health to deliver this webinar. It's a pleasure to be here, and I've had the pleasure to work with a number of workplaces who've experienced positive COVID cases. And I'm here to share our lessons learned and ways that you can prevent, you can mitigate the risk of spread of COVID-19 in your business, and what to do if you identify positive cases. That's what we'll go through. We'll go through the Ontario's framework for reopening, available resources for you as you reopen and embark in phase 2. And then we'll go into the nitty gritty of who needs to isolate, what happens when a positive test is identified, and we'll go through frequent questions that businesses ask us. So the province of Ontario has provided a very helpful workplace safety strategy. And it provides you with this inverse pyramid. The top of the pyramid are the most effective measures to prevent the spread of COVID in your business. And it relies on elimination. The concept of elimination is keeping COVID-19 outside of the business. So keeping people who might be incubating or who might be displaying symptoms of COVID-19 from entering the workplace and infecting others. One example of elimination is screening. So screening every employee for symptoms of COVID-19 so that if they've been in close contact with someone or if they've engaged in high-risk behavior like travel, or if they're experiencing symptoms, they know not to come to work. The second part, or as we move down the pyramid, you'll see substitution, which doesn't apply in this case. Engineering controls are the second most effective way of preventing COVID-19 in your workplace. And I should specify that the ideal strategy employs every element of this pyramid. Engineering controls are physical changes to the workplace. So physical changes to the workplace that employ the core 4 behaviors that we'll talk about in the next slide. Physical changes can include the installation of plexiglass barriers, removing lockers from crowded locker rooms, installing hand washing stations, moving to touch-free workplaces, touch-free payment options, and allowing for additional lunch space so that people don't have to congregate in one room while they're eating lunch. All of those physical changes to the workplace are part of the engineering controls. As we move down, administrative controls are changes to policies in your workplace. So, examples of administrative controls include cohorting workers, making sure that the same line of workers work the same shifts so that if one gets infected, the entire workforce doesn't need to go home and isolate, only certain people do. Other examples of administrative controls include informing your employees about their sick leave, and other ways that we can employ the core 4 behaviors. And the last is PPE. There's been lots of talk about PPE with the new bylaw on masking. So ensuring that people have a non-medical face mask and face shields in instances when they cannot maintain 2 meters distance from one another. I'm sure many of you are familiar with the core 4 behaviors, but I would be amiss if I didn't talk about them. And the pyramid that I explained, or that I showed in the last slide, is really just a technical way of embodying the core 4 principles, which are to stay apart, ensuring 2 meters apart from employees and customers, lathering up, so ensuring good high hygiene, masking up in cases, masking up and getting tested. Workplace safety, I'll walk you through the workplace safety plan, but this is readily available on the province of Ontario's website. And the workplace safety plan prompts businesses to ask themselves 6 main questions. One is, how will you ensure that workers know how to keep themselves safe from exposure to COVID-19? This question ensures that employees know how to keep themselves safe in the workplace and outside of the workplace. Ensuring that they know where to get tested and when to get tested and when not to come to work will help keep everyone safe. The second is, how will you screen for COVID-19? And that harkens to the elimination part of the pyramid that I just showed you. Number 3 is, how will you control the risk of transmission in your workplace? And what will you do if there's a potential case or a suspected exposure to COVID-19 at your workplace? And we'll talk about all 4 of those questions today. Number 1, how will you ensure that workers know how to keep themselves safe from exposure to COVID-19? Here you'll see pictures of different informational posters that are available in a range of languages. Keeping workers and your business safe from COVID-19 really relies on your ability to understand your employee profile. What languages are they comfortable in? What is their ideal contact information? And understanding your workplace better will allow you to anticipate vulnerabilities and to respond. So knowing how your employees come to work, whether they carpool, whether they take public transport, all of that is helpful in providing them with anticipatory advice on how they can stay safe. So a number of resources are available on Peel Public Health's website. You'll be getting a copy of these slides, and feel free to go through them to provide your employees with information that they understand best. How you'll screen for COVID-19. And again, like we talked about, the purpose is to prevent people with symptoms from entering the business or people who might have been in close contact with people who have had COVID-19. There are two flavors of screening. One is active screening and the other is passive. Active screening involves somebody asking the employee questions. Do you have any cough, cold, or other symptoms consistent with COVID-19? Passive screening involves the employee asking themselves certain questions, either through the form of a checklist or questionnaire. Both of these resources can be available on Peel Public Health's website. This also is the elimination part of the pyramid. So prompting employees to ask themselves whether or not they have symptoms every time they come to work can help eliminate COVID from your workplace. Moving on to number 3, and this speaks to the entire pyramid. So how will you control the risk of transmission in your workplace? So undoubtedly, the cornerstone of reopening safely is employing that pyramid we talked about. So ensuring that and tailoring it to your unique business. So looking at places where employees might be in close proximity to one another, or where there are high touch surfaces that might get infected. There are a variety of unique things in each workplace, each business that could render you vulnerable to COVID-19. So working through the workplace safety plan will help you identify those. Examples of controls include maximizing physical distance and separation. So if you're a manufacturing plant, you can slow down the rate of the conveyor belt so that there are fewer people who have to be spaced alongside the belts. Other examples include installing plexiglass barriers when physical distancing isn't possible, ensuring that people have face masks and face shields in instances where they're in close proximity. Ensuring that there are good hand washing stations readily available, and inserting extra cleaning shifts or frequently disinfecting high-touch surfaces. So that includes plexiglass barriers, places where employees clock in and clock out, or frequent high-touch surfaces, ensuring that those are disinfected. So really getting creative and looking at your business from a variety of lenses to identify places where those core 4 behaviors might be difficult to implement. And this slide just speaks to what we were talking about. And I think the one thing I want to emphasize here is that while masking and PPE might provide employees with a sense of protection, really ensuring that your business is safe relies on a number of controls: engineering controls, policy changes to the workplace, and good screening. So we've talked about a lot of this: elimination, engineering, so hand washing stations, plexiglass barriers, policy changes, so cleaning and disinfecting protocols, creating limits to the number of people who can be in a locker room or a lunchroom at the same time, and cohorting employees. But of course, every workplace is different. Every workplace has different vulnerabilities. So the province has come up with a set of helpful resources that are tailored to your unique business profile, whether you're a restaurant, and whether you're in the retail sector or food processing sector. So you can find those here at this linked website. Now, despite your best efforts, there might be an employee who tests positive in your workplace, and Peel Public Health is here to support you every step of the way. So let's walk through what would happen if an employee were to test positive. Number 1, ensure that the employee does not come to work. That's a given. So advising the employee to self-isolate for 14 days and to get tested at their nearest testing assessment center. The second is contacting public health. So you can reach Peel Public Health at 905-799-7700. But if an employee calls you and tells you that they've tested positive, calling public health is helpful because it can help with case and contact management. Following public health guidance. So public health might assist you in making certain recommendations to your workplace and implementing those. And then the last part is ensuring that you notify the Ministry of Labor, Training and Skills Development. So under the Occupational Health and Safety Act, you're responsible for informing the Ministry of Labor of any positive cases. Now, this doesn't necessarily mean that an inspection occurs or that fines are levied or anything like that. But it's just helpful to track the number of cases in different workplaces and is required. It is required to report to the Ministry of Labor. So who's responsible for what? So as an employer, you're responsible for taking all reasonable precautions to protect your employees and to notify the important people, the important players in this game. Our role in public health is to lead workplace investigations. And we'll talk about what's included in a workplace investigation. And then our second role is, and this is a key role of public health, is to do case and contact management, declare outbreaks, and provide recommendations. And we'll talk about every step of every part of this bullet point. And the ministry's job, the Ministry of Labor's job, is to investigate occupational illnesses and to, in some cases, conduct investigations and issue orders. So what happens? So an employee tests positive, so that's a positive test, and public health is informed of the results. What public health does is they contact the employee, and they do that to answer two main questions. One is, where could you have acquired COVID-19 and who might you have affected? Depending on what that positive case answers, it might trigger a workplace investigation. So, but to answer those two questions of where could you have acquired COVID-19 and who might you have infected relies on two key principles that I'm going to share with you today. So one is the period of communicability. When could you have been infectious? So 48 hours before the onset of symptoms, if you test positive. So we look at anyone you might have been in contact with 48 hours before you develop symptoms. Throughout that period, who you were in close contact with. Or if you never had symptoms but you tested positive 14 days before the test, we consider you to be that's your period of communicability. That is when you are at risk of spreading COVID-19 to someone else. And then who's a close contact? So the most recent guidance says that a person who has spent 15 minutes or longer closer than 2 meters apart is considered a close contact. I would caution you to rely strongly on that number of 15 minutes. There are certain circumstances where you might have spent 5 minutes or 10 minutes in close contact with someone, and that would still render you high risk based on a variety of other factors that are beyond the scope of our presentation today. If you are unsure, feel free to contact public health and we'll help you work through this question. What triggers a workplace investigation? So if an employee says, well, I went to work during that period, 48 hours before I developed symptoms, and during my symptoms, public health will ask certain questions about the workplace to gauge the risk of that employee infecting others. They'll ask about physical distancing measures, plexiglass, whether or not there's lots of hand washing, a variety of factors. And if it's deemed that other people in the workplace might have been exposed or are at risk of being infected, public health will open a workplace investigation. The type of information gathered in a workplace investigation are the number of employees in the business, the type of work, and other vulnerabilities that we've discovered. So whether it's a factory setting, whether they're shift workers, agency workers, and any sort of unique vulnerabilities in your workplace. Preparing for a meeting with public health, we work closely with businesses, and it's our pleasure to be as helpful as possible. So in anticipation of meeting with us, it's always helpful to have drawings or layout of your workplace for us to be able to understand whether there's a cluster of cases in a particular area, photos of the workplaces, but the most important thing is knowing your staffing schedule. So who worked with who on what days. If you are a business that has lots of employees, or knowing the list of clients, customers, or visitors who have come through, and a list of other people who might have been exposed. Now, obviously not feasible in every business, but to the best of our abilities, understanding who might have come in contact with that positive case is helpful because it helps us stomp out the embers of COVID-19 in the community. Now, the term outbreak can be overwhelming for businesses. So when is an outbreak declared? So when there are 2 or more cases of COVID-19 in the workplace in a 14-day period, we suspect an outbreak. But it can't just be any 2 cases. It has to be 2 cases who are thought to have reasonably acquired the infection in the workplace, meaning they don't have, it could be not 2 people who have close family members who are cases. They have no other source of COVID-19 infection in their lives. So no obvious source of infection outside the workplace, or there's a known exposure inside the workplace. That's when an outbreak is declared. epidemiology of the outbreak. So the public health will look at the number of cases, when they did develop symptoms, where they worked, and they'll look for specific exposures in the workplace. They'll review staffing schedules, and we'll work through an example to illustrate this. This is a question we often get. Who needs to self-isolate during an outbreak? All employees identified as a case, so anyone who tests positive needs to isolate for 14 days, and anybody who's a close contact. So that's the concept we just discussed. So close contacts must isolate for 14 days after their exposure. Non-close contacts might be asked to self-monitor for symptoms or get tested. Who needs to be tested? So in an outbreak, public health, Peel Public Health will make recommendations on whether mass testing is recommended or who should be tested on certain shift lines, etc., based on their risk profile. We'll also provide you with a letter and an outbreak number to ensure that the cases associated with your workplace are traced appropriately. Let's work through common questions we have. So when can employees come back to work? So we've identified a positive case, and who and when people can come back to work. So if you're positive and you have symptoms, you have to isolate for 14 days after your symptom onset. You can come back to work when you haven't had symptoms for 24 hours. But if you're a positive case and you've never had symptoms, you still have to isolate for 14 days from the day of your positive test. Now, what about negative employees? Sorry, not negative employees, but employees who test negative for COVID-19. The crux here is that not everybody who tests negative can return to work. The caveat is that employees who test negative but have still had a close contact with somebody who's a positive case must still isolate for 14 days. So that's somebody who's tested negative but is a close contact. If you've tested negative and you're not a close contact of anyone, you can return to work as long as you don't have symptoms. If you have symptoms, you still have to stay home. And that is in keeping with your screening guidance. So if your poster on your workplace says don't come to work with a runny nose or a fever, that's in line with your own workplace guidance. When can an outbreak be declared over? An outbreak is declared over once you meet two criteria. One is that there are no new cases within 14 days, and that's to ensure that no new cases are cropping up. And the second is to ensure that you not only have no new cases, but you've implemented the measures we've spoken about that public health has recommended for you, so that we can ensure that the risk of another outbreak in your workplace is low. So I'm going to walk you through this example really quickly about an investigation, a large workplace investigation that we conducted here in Peel. Of course, maintaining confidentiality at all times. So we've changed certain details and did our best to maintain workplace confidentiality. So this was a large manufacturing plant with over 200 employees, and it was a mixed profile. There was an office component, but also a plant component. We received multiple daily positive cases, and a total of 55 cases, or almost 20% of the workforce, was infected. This is an example of what our case and contact managers create using, it's called a line list. And I'm showing you this so that you understand how we use that information. So the black box is symptoms, the day the individual develops symptoms, and the L says their last day of work. So you'll see here that in the second line, the individual develops symptoms but continued to work for 2 days before their last day of work. That's how we look at your period of communicability and who else you might have been infected. The reason why I'm showing you this picture is it's not so that you come and work for us at Peel Public Health, but so that you understand how important it is to know who's worked with who and to have a good idea of your shift structure. And then this is what we developed. This is an epidemiology curve, or an epi curve, we call it. And the different colors look at the different areas in the workplace that had clusters of cases. I'm just showing you this to show you how we use this information in determining areas that might have been vulnerable. Our key take-home messages in this investigation were that close communication was important and critical in managing this outbreak. The plant management closed within 10 days of the identified case for cleaning. Now, this is something that we haven't recommended as of yet. We haven't yet recommended that a business close fully. And that's important to know. We, at all times, do our best to ensure that businesses maintain their viability and are able to continue their functions as much as possible, even in the midst of positive cases. The second is that We identified that at the time no masks were used, that there was machinery that caused people to cluster in certain work areas, and a key vulnerability were people who floated from different places of the workplace, and that propagated the spread of COVID-19 in the workplace. Take-home messages for you are to build a resiliency plan. So as much as our commitment is to work closely with businesses to prevent the spread of COVID, it's also helpful for you to do your best to imagine a scenario where some workers might have to go home and self-isolate, and how you can maintain operations in that scenario. One of the ways you can do that is something we alluded to quickly before, but was workers. So ensuring to the best of your ability that the same lines of people work together so that you minimize the number of people who might be close contacts and who might have to self-isolate. Work through the workplace safety plan. It's a helpful way that goes into a little bit more depth of what we've discussed today. Maintaining clear and supportive communication with employees is crucial. Knowing, having updated lists of individual cell phone numbers, ensuring that there are policies in place that don't penalize individuals for coming forward and being forthcoming about their symptoms. All of that will inspire your employees to be forthcoming with their information and will allow for you to kind of anticipate and mitigate the risk of COVID in your workplace. These slides are just a series of very helpful resources, which I understand you have many of, but everything I've spoken about in the presentation today and a little bit of extra guidance for you. Now we'll speak quickly about masks, and then we'll open up to questions. So masks alone will not prevent the spread of COVID-19. That's critical to understand. So masks, we don't want masks to provide individuals with a false sense of security, or it's not a safety blanket. Masks are only effective when they are combined with the 4 core principles we discussed above. Now that you understand what is meant by close contact, you understand how powerful that concept of physical distancing is. So you aren't considered a close contact if you have been more than 2 meters apart from somebody. So that should inspire you to think about ways that you can ensure physical distancing in your workplace to the best of your abilities. Understanding, of course, that it's not always possible. The use of non-medical masks may help you protect others, and when wearing a mask, it's important to practice good hand hygiene and physical distancing. So we'll walk through how to put on a mask, and before you put on a mask, make sure you wash your hands. That's to avoid contaminating the mask with any surfaces or any virus particles you might have acquired before touching your mask. Secure the elastic loops behind your ears. If you're using a cloth mask, you can tie it behind your ears, but ensuring that your hands are clean before you do that. Cover your nose, mouth, and chin, and ensuring that there's a seal between the bridge of your nose and your face. And number 3 speaks to why face shields are not a substitute for masks, because that seal or that distance between the mask and your face is not possible with a face shield. Don't touch the front of your mask while you wear it. So we found that in some cases, like we spoke about before, the idea of a mask empowers individuals to kind of breach physical distancing. That should not be the case. Understand that physical distancing with mask wearing is crucial. So try not to touch the front of your mask, and then off the mask, wash your hands again, and put the mask in a clean bag or envelope if it's a reusable mask, and if it's not, dispose of it. Remember that masks are considered contaminated after every use, and so if you have a reusable mask, making sure you wash it after every day, and if you have a single-use mask, making sure you dispose of it. This provides you with an overview of types of masks. Procedural masks, which are medical masks, the type I use in the ER, cloth masks, and N95 respirators. It should be noted that even in the healthcare setting, we ration N95. So in my usual ER shifts, I don't wear N95s at all. We save that for when we might be conducting high-risk procedures. So that just speaks to how valuable these masks are and how important it is to use non-medical masks. And that's it. So I'm open to any questions you might have.
Great. Thank you, Dr. Sunderji. Very informative presentation. And I would like to actually ask could you go back to the line slide that you had, the Excel spreadsheet? If you could explain that line chart again, I think that was very interesting.
Okay, I didn't know if it was this. Is this slide?
Yes, that slide.
Yep. Okay, great. So the orange boxes refer to your period of communicability, right? So that's the concept we talked about. 2 days before onset of symptoms, 14 days. And so you'll see the orange boxes are your period of communicability. The black box symptoms are the date of your symptom onset. So 2 boxes, 2 days before your symptom onset, you're still part of your period of communicability. And then the L is your last day of work. So when somebody tests positive, if an employee tests positive, you can say, well, when did you develop symptoms and when was your last day of work? And you understand then sort of the work we do. Now, this is not your job, and public health will work closely with you while we do it, but this is the information we consider. Is that helpful?
Yes, it is. So if I take a look at the middle one, the second SX, so the 2 days before is that period of communicability. And then it extends actually for another week and a half, it looks like 2 weeks almost.
Exactly. So, and so you see, so this actually, Walter, I'm glad you're picking up on this. So this exactly speaks to the importance of screening. So this individual had a cough, cold, runny nose. They had symptoms on this day and they still came to work. So that speaks to the importance of elimination, preventing people with symptoms from coming to work. And it also speaks to the importance of maintaining clear communication with your employees to ensure that they don't feel pressured or that they'll be penalized coming to work with symptoms. Does that make sense?
Yes, it does. And I wanted to ask about the case study that you cited. So could you elaborate a little bit more from when the company actually shut? So there was a 10-day lag from when you started to when the plant was actually shut down. Is that correct?
Yeah, Walter, I don't want to get too bogged down in the details because I will say, having worked on multiple investigations, that the recipe on how we proceed is very much tailored to the workplace.
Okay.
Up where and what the risk profile was, whether there were individuals on an AM shift and an evening shift, both who were infected, how widespread the cases are in the workplace, whether we identified a source or not. So, I don't want the message to all of you to be plants must shut down and within a positive case. That's only in certain circumstances.
Okay.
And remember that this was very early in our days with COVID. This was in May. This was before masking. This was as businesses were learning. And so the reason why I presented this to you is so that we can learn from each other. But definitely the recipe of what public health will recommend is completely tailored to what you've already implemented in your business.
Okay, great. Thank you for that. And then following up on that, we have a question about how is privacy addressed in dealing with reporting a confirmed case of COVID-19 in the workplace?
That's a great question. So, in privacy, so maintaining employee confidentiality is crucial. So, in the case of an outbreak, that's why a letter is provided to you to say there's been a positive case and there's no further details on who tested positive. There's two components of privacy. One is the employee's privacy. And so if the employee doesn't share with you that they tested positive, PA Public Health will still there's still a safety measure for public health to conduct a workplace investigation. Because public health, regardless of whether your employee tells you they tested positive or not, will call the individual and will say, well, where did you work? Who might you have infected? Answering all of those questions. So whether your employee is forthcoming or not, will not prevent public health from doing its work. The second is to do with your confidentiality. And so workplace outbreaks are not regularly, routinely disclosed to the public unless there's significant risk to the public. At all times, we do our best to maintain the confidentiality of your business.
Okay, then following up on that, we have a question about if somebody's actually the health and safety rep, and if they're vulnerable to COVID due to an underlying health issue, and they're supporting a colleague with a potential case of COVID in the workplace, is it recommended in that case to hand it over to the supervisor in this scenario?
I'm just looking for that question to understand. So there's an individual who's high risk who then works in a high risk setting. Is that right?
Yes, the person would be a health and safety rep. So ostensibly, they might usually handle a case like this, but if they've got underlying health issues, can they hand that over to a supervisor in this scenario? Like how would that work with engaging Peel Public Health?
So it depends on it. They work for public health?
No, the health and safety rep of the company.
The health and safety.
So they might have underlying issues that might compromise their ability.
I mean, ensuring, first of all, that the health and safety rep shouldn't be exposed on any case, right? So the health and safety rep might be somebody who just answers the phone call and says, oh, okay, George is feeling sick today. He shouldn't come to work. But the goal is for nobody to be exposed, whether you're the health and safety rep or the supervisor. Nobody should be dealing in close contact with an individual who might be suspected of being positive, which is why screening is so important.
Okay, and then with respect to, you talked about, I think a little bit about asymptomatic workers. So those that test positive, someone has asked, can public health provide us with written confirmation that a worker testing positive that is asymptomatic will not transmit the virus to others?
So remember, if an individual tests positive but are not symptomatic, they still have to isolate for 14 days. So we can go back to that slide, but an individual who tests positive, regardless of whether or not they have symptoms, must isolate.
Actually, yeah, you know what, Alia, I think that I'll make you the presenter again. I think that just going back to those slides would probably be good if you don't mind.
No, I don't mind. I'm just here to be helpful. Can you see can you see? Right. No, it's an important concept, so I'm happy to talk about it. All right, this is our algorithm for a positive case. The individual tests positive but doesn't have symptoms, so we're on the right side of the diagram. They still must self-isolate for 14 days. The only difference in this picture is when they have to isolate from. So it just means that the individual who was asymptomatic didn't know they had COVID. So they must isolate the second they find out they're positive. They have to isolate for 2 weeks after that positive test.
So another question related to that, as far as procedures then go, does Peel Public Health have any templates that can be used by business to help create internal procedures and forms as well as internal communications?
Internal communications, there's a wealth of resources on our website. So I'd encourage, and new resources are coming out every day. So I would encourage you to take a look at our website and take a look at the province's website, because there's so much helpful resources, particularly for your sector, that's tailored for your business, that I'd encourage you to take a look at. And it might be in different languages to ensure that employees who are more comfortable in another language are able to understand, because you can already see from our presentation, these are complex ideas. So ensuring that somebody can understand it as in their most comfortable language is very helpful.
Okay, and I'm wondering too about employees coming to work via public transit. Are they considered at high risk to exposure, and what would be the remedial solutions for that?
You know, Walter, I get this question a lot, like this idea of who's high risk. And I'd encourage all of us to think about moving forward, as we are all living with a baseline risk of COVID-19, which is why, regardless of whether or not you take public transport or not, those core 4 behaviors are important. Everyone should act and behave as if they are high risk. So the question about is an employee who takes public transport high risk? Well, now you know that mandatory masks are mandatory on public transit, and I wouldn't ostracize or highlight certain workers who might not have any other option than public transit. So,
right.
So what I would encourage all of us to think about, I mean, there are some circumstances, whether you're immunocompromised or have other comorbidities, where you're certainly high risk, but everyone should act as if there is a significant element of risk in what they do, which is why those core 4 behaviors are not, while they might seem simple on the outside, like washing your hands or maintaining a distance, they're actually quite powerful. Does that make sense?
Yeah, no, fully understandable. You know, I'm just following up on the question. So somebody who takes a 30-minute bus ride from their residence to work, if they're wearing a mask, let's say they wear gloves, they're doing their best to maintain their physical distance from their fellow passengers. They get to work, they take off their mask appropriately, they wash their hands appropriately. How much of a risk are they?
You carry on, because we can't, you know, that employee might, their risk profile might be that they take transit to work. Somebody else might have a different risk profile. They might live in a large multi-generational home. That's their risk profile. And so one person's risk, we can't kind of weigh one person's risk against another. The importance of what's important to reiterate is whatever you do, whether you take public transport, whether you live in a large house, whether you live alone, everyone needs to do their part, I think. So as long as you employ the core 4 behaviors, for that individual who takes transit for 30 minutes, washes their hands before touching their face, removing their mask, disposes of their mask, or stores their mask in a reasonable way, then they have to then carry on.
Okay. And you mentioned this, and so we have a question about employees that live with immunocompromised family members. So you talked about generational families. What would be the best strategy for them if businesses start reopening? From what I'm getting from you, the strategy is the same. You still have to take the same level of precautions.
Exactly. Exactly. The importance of the importance of those behaviors is just that. Exactly. So that we can protect those who are most vulnerable, whether they're our grandmas who live with us or whether they're our neighbors. It's just important to keep, those are the core 4 behaviors that will keep everyone safe.
And then you talked about masking, and then the fact that you don't even wear N95 masks all the time in the hospital setting, that you'll wear surgical masks. So is there a mandate? Do you see a specific level of mask in a work environment, or what would you recommend in a work environment?
So Walter, those you know, the certain businesses do require N95 masks, whether they're dealing with specific chemicals, but that's handled by the Ministry of Labor and that unique workplace. So I didn't, and I'd like to clarify, I don't mean that N95s have no place outside of the hospital, certainly
Right.
not. And there are certain circumstances where they're needed, where they're mandated, but ensuring that they're available for those workers too who are at risk, instead of using them in places where they are not appropriate.
And we have another question, Dr. Sunderji, on testing. And do you see mass testing, and have you heard anything about privacy in the Privacy Act in testing? Can an employee actually refuse? I don't know if it.
So an employee can refuse to be tested. So, and we've had those circumstances arise in workplaces where an outbreak has been declared and an individual refuses to be tested. I will say that in my experience so far, working closely with the employee and informing them of, you know, how many people might be at risk and how helpful that information is. Now that you've seen, and I think that's why I showed you the line list, is now that you've seen how we put all that information together, you can really appreciate the difference between 1 case and 3 cases and 4 cases. So reiterating or trying to understand, number one, what that individual might be fearful of or why they don't want to be tested. And number 2, informing of them of how helpful it can be to have that information has been really helpful. But if an individual is adamant that they will refuse to be tested, then they must self-isolate at home based on our guidance.
And then I have another question about the 14-day self-isolation for someone who tests positive. After that 14 days, are they still a risk to other people? And then the person asks, is it still necessary that the person must wear a mask to protect others?
So, well, now with the masking bylaw, if you're indoors in a public space, you always have to wear a mask. And even if you have symptoms and you were within the 14-day period, you should not be walking around. You're isolating at home. You're not going to the grocery store. You're not going to the pharmacy. You are at home. So the question is, you've tested positive, you've done your 14 days at home, are you still at risk? And the one thing that relies on is, do you still have symptoms? So, 14 days is just a guideline. But if you continue to have fevers and runny noses, you should act as if you are still infectious. So you should absolutely continue to self-isolate. And if you have any questions based on your unique profile, public health is always here to answer them. So I'd much prefer you to call public health and finish your 14 days of isolation and call for guidance based on what symptoms you're having than to make a decision.
Okay, and I'm interested as well. I just want to tell everyone that's on the call today that we will be providing a copy of Dr. Sunderji's presentation. We're providing links to those resources as well. And we have a question about site visits and whether it's the City of Mississauga, the Region Appeal, to ensure compliance and related best practices. Could you speak to that, please?
So there's no kind of request a site visit to make sure everything is top notch, ready to go. There's no system for that just yet. And the idea is that presentations like this and the resources we provide you with give you with a lot of bolster your confidence in kind of putting into place measures to implement the core 4 behaviors and implement that pyramid. Now, right now, the Ministry of Labor doesn't conduct site visits on a prophylactic or interest-based indication. So there are circumstances when investigations are conducted, but those are related to outbreaks.
Okay.
Whether that's something the city wants to explore or the Ministry of Labor wants to explore is an idea that might be of interest later.
It's our hope by having webinars like this, having this webinar available afterwards to people that weren't able to attend today, that we'll be able to get that message out. And I can certainly see that we'll continue to try and get the message out in collaboration with Peel Public Health as well. So I think that's very important. I did want to ask you, this is more of a general question on vaccines. And I'm just wondering, in your own reading and in your discussions with your fellow professionals, is there anything you can provide as far as an update on the search for a vaccine? And in your opinion, where do we stand with respect to that?
Walter, like $1 million question, eh? I think that a vaccine, we're hopeful. I think that people are moving into human trials now. Timeline-wise, nothing is guaranteed. And once a vaccine is developed, there'll still be questions on how it's rolled out and how it will become available, who will be immunized first. So, I was asking around, anticipating this question, and people threw around the idea that perhaps, spring of next year. But to be honest with you, the jury's still out. And while we're hoping, a vaccine has to understandably, a vaccine has to meet a lot of standards before it's disseminated to the public. It has to demonstrate efficacy. It has to demonstrate safety. Vaccines really have to prove themselves. We're very careful before we deliver them. And so until a vaccine shines, the core 4 behaviors are all we have.
So, Dr. Sunderji, we're coming at time with our presentation. Are there any closing remarks that you'd like to make based on the questions and what you've been hearing?
All I can say is that, my work with businesses like yourselves has been incredibly rewarding. I found that many of you have been so innovative in collaborating with each other and sharing ideas of what's worked. And that really is the spirit of how we'll move forward, is speaking to other businesses who have similar profiles to yours and what's worked, and learning from each other. So, there are many of the solutions we suggest later come from businesses who have tried to be creative, who understand, your business best. And so, being as creative as you can and thinking about ways that you can ensure physical spacing while allowing individuals to take their lunch in a comfortable way and to use their locker rooms in a comfortable way while keeping them safe. Your business is best, and I want to empower you to do everything you can to keep your employees safe. And I know you will, because the businesses I've worked with have been so innovative and so creative. So congratulations and good luck as we move forward. Peel Public Health is here with you every step of the way to support you.
Great, thank you very much. And again, to our attendees today, we will make Dr. Sunderji's presentation available to you. And we also are recording the webinar today, and we'll also in a future date make that available. And I just want to quickly remind everyone that on Monday at 9 a.m. we'll be having a webinar on the mask bylaw, the City of Mississauga itself, where we'll also have our Director of Bylaw Enforcement speaking to it, and a representative, one of your colleagues, Dr. Sunderji from Peel Public Health, speaking as well. I don't think we can do enough about talking about proper mask use and dispelling some of the myths and making sure that people are using them correctly. So again, I want to thank you very much. And I also would like to thank your colleagues at Peel Public Health, including Valerie Lamb-Bentley, Sandra Fitzpatrick, Dr. Catherine Marsilio, for all their support. We look forward to continuing to work with you to get the message out to businesses so we can prevent the transmission of COVID-19 in the workplace. I'd also want to thank my colleague Jackie O'Connor for all her efforts on our webinars, and this webinar particularly. I'd like to thank Amanpreet Bains for all her support as well in our Economic Development Office. And I want to thank everybody here that's attended today. Please do not hesitate to reach out to our Economic Development Office if you have any questions, and we look forward to working with you in future. So I just want to thank everyone and stay safe and have a great day.